Hi, it's Lynn, and welcome back to my channel. Today, we're going to talk about the pros and cons of using medication for hair loss. As always, I'm sharing this information as someone who has alopecia or is battling alopecia. I'm not a physician. I'm not a hairstylist. I'm not a trichologist. I'm not a nutritionist. I'm someone who is currently in remission with alopecia, as you can see here. But I am sharing what I've learned and what I'm learning when it comes to taking medication for hair loss. So today I'm going to talk a little bit about my journey with medication, and then I'm going to go down a list of pros and cons that I'll share with you. First, my journey with medication. So when I had my first visit with the dermatologist, she recommended a medication called clobetasol, I think it is. And if you've seen any of my previous videos, you know that that experience was not the best with that physician, and I actually ended up getting a second opinion and finding a second dermatologist. And once I got the official diagnosis, and that also included a biopsy of early scarring alopecia and a couple of other types of alopecia as well, that she kind of added in there. But once she also heard that or saw that the first dermatologist recommended clobetasol, she actually said that that was too strong for me and recommended a different one. And so I ended up taking mometasone furoate, which is, or getting prescribed mometasone furoate. I'm not sure how to pronounce it. Topical, it's like a liquid that you use on the scalp to bring down that inflammation, and it doesn't go into the bloodstream. That was one thing that I wanted to ask the doctor for something. If I was going to use something, I wanted something that didn't go into the bloodstream. She indicated that it didn't. I did my own research, and from what I saw, the majority of the opinions were also that if you use it in its normal prescribed way, that it would not go into the bloodstream. And so that was what she recommended. The other thing that we decided with the medication, actually, I had decided that I was going to take the moment, I was going to get the prescription, but then also I really wanted to focus on a holistic approach because, quite honestly, at that point, I had already come to grips with the fact that it was balding, it was leaving. And so I started using scarves. I had become more comfortable with even the shortest of the hair approach. And I really wanted to really focus in on the holistic side because I knew that it was something going on internally. So with the physician, actually with the dermatologist, we actually agreed. I said I would use it as needed, as necessary as I wanted to, but I would really focus in on the nutrition side of things and supplements. And she was in full agreement with it. And so 6 months later, when I went back and my hair started to grow back, having not used a significant amount of the medication, she said, keep doing what you're doing. And so I do keep it on deck. I actually have it in my cabinet now. So if I do feel a flare up coming, I have no problem using medication. I think that God can heal and restore in a lot of ways. I think he can, if he chooses to use medication, if he chooses to use supplements, if he chooses to use all of the above. I am a firm believer that healing can come in whatever way he chooses. So anyway, so that's my kind of journey with medication. So I have it on deck if I need it. And I really focus in on the supplement side. And at the same time, I'm in a CCCA Facebook group. And what you will find in that group is when people say, should I use medication or not? I think the growing consensus is that get something, if you can, prescribed, because you have to slow down that inflammation as quickly as possible, because CCCA is an inflammatory condition. And if you don't tamp it down and slow down that inflammation, according to the research, the reading, the different people that I've had on, on the channel to talk about it, if we don't get that inflammation down, it will damage the hair follicles. And so that is really, really important. So the question is around, which really might be around what's the quickest way maybe to get to reducing some of that inflammation, along with some of the other things we're going to talk about. So let's talk about the pros and cons of using medication. First up, they're effective, right? Medications have been proven to be have some level of effectiveness. Medications can help slow down hair loss and in some cases help promote regrowth. So when we think of something being effective, it's like The question is, does it work? And so there is evidence, whether it's scientific in the research journals, whether it's people's personal experiences. And I would love for you to leave a note in the chat or in the comment section if you're using medication or if you have used medication. So my question to you is, how effective have medications been if you're using medication? The second pro or benefit of using medication is that it's convenient. Medications are often easy to use and can be applied orally or topically, depending on the specific treatment. The third benefit or the third pro is that there are medications that are approved, right? So they're approved by the FDA or they're approved by regulatory agencies. I think when we had Dr. Nina on, she was saying that there were some medications that were not officially approved for hair loss, but we know that there was recently one for alopecia areata that is FDA approved for hair loss. So the next pro is that medications are non-invasive, meaning that they don't require surgical treatment. And for those that don't want to do the surgery or hair transplants or are just not interested in having surgical procedures done, medication could be a great opportunity or a great resource for you to utilize. The fifth pro is that there's broad applicability for several medications. Sometimes these medications can treat various types of hair loss, which is important, especially if you have been diagnosed with multiple types. And so that was actually, again, one of my areas is where I had early scarring alopecia here, but I was also getting the hormonal hair loss, perimenopausal, menopausal, around here, this area as well. And so sometimes these medications, the one medication, I didn't get any other treatment options. My doctor did not recommend any other prescriptions, but we could use that particular medication on my entire scalp as necessary. Again, I probably should have said this earlier, but I think it took almost a year to go through, almost a year and a half to go through a whole container like this. I didn't use it consistently is probably the best way to describe it, but I did use it. The sixth pro is early intervention. Starting medication early in the hair process may yield better results, preventing further hair loss. And so, again, I think I mentioned this a little earlier, but in that CCA Facebook group, there were so many women who, when someone says, well, what should I do? What do I need to do? The first thing that most people will say, in addition to some of the holistic approaches, is work with your dermatologist to get something to help slow down or really stop the inflammation on the scalp. And a lot of times topical medications might be the best way to do that. And the seventh pro that is probably more of my approach is that medication can be used with other therapies. So for example, I focused a lot on nutrition and supplementation. And again, if I needed it, I would use the medication. So that would be considered, from what I understand, a combination therapy. And so when it comes to combination therapies, one thing that I loved about the interview that we did with Dr. Nina, I'll link that here. She actually, with her patients, she works with their doctors as well. So it's actually having the expertise. She does an amazing job of you get her expertise as a trichologist, but then she also works in partnership with the physician, with her patient's physician. And that's a win-win right there. So those are some of the primary pros of using medication. So now let's talk a little bit about some of the cons. But before we do that, I did want to share a story with you that has really kind of been burning in my heart, right? So if you watch this channel at all, you already know that I'm a believer, I'm a Christ follower. And in the last couple of weeks, I've really been thinking about the scripture in John 9, where Jesus heals the blind man. If you're a believer, you've probably heard this story before. And if you're not, it doesn't matter. You are welcome here. So I wanted to share a little bit what I've learned about this story. And now keep in mind, I'm not a Bible scholar. I'm just sharing what I've learned and what resonated with me. And when I think about us and those of us who are praying for and asking for and believing healing in the midst of a lot of these hard times, like this story just rang out to me. So I just wanted to share with you what I've learned and hope that it encourages you too. In John 9, Jesus is walking down the street and he notices a blind man. And the first thing the disciples ask is, well, why is he blind? Is it something that he did, or is it something that his parents did? And Jesus replies, neither. He says it was so that you could watch him experience God's miracle. So I'm going to say this too. I said this earlier. Like, I believe healing is possible. I believe that God heals. I believe he heals on this side of heaven. I believe he heals in heaven, right? And it's not up to me. I can't tell him what to do. I can ask. And I believe that it's a gift that he can choose how he wants to give it. And it's really up to us to receive it. So I do believe that God could use medication to heal 100%. I do believe he could use supplements. I do believe that he could say, wait, not now. I'm here with you. Like all of the things. I think he can do that. I also think we can ask. I think we can seek. I think we can look for. And I think he cares. Anyway, so in this case, Jesus says essentially, it was so that you could watch him experience God's miracle. And in this case, he chose to use spit and clay to heal. The thing that I learned from the Passion Translation, there's a little segment in the Bible there. And they say that during this time, it was believed that blindness was a curse. And so when people were blind, there was a gesture that people would use to show their disgust, which was spit. Like they would spit on the ground if the person was blind. And so what blows my mind, the same gesture that was used to denote disgust for someone who was sick is the same gesture that Jesus used to heal. The compassion that comes through about Christ and about healing and about meeting people where they are, it's amazing to me, right? Especially because a lot of times when you read the healing and the gospels, that people went to Jesus, or people, the woman, when she touched his hem of his garment, or people asked, or people, they opened up the ceilings, let their friend down. People were coming to him. In this scenario, there's no indication in the way that this is presented in John 9 that this person even knew Jesus was coming to him. He didn't know. It doesn't read as though that he even knew that it was Jesus that was spitting on the ground. So he's used to, according to the culture, if the culture plays out the way that the historical reference indicates, he's used to hearing spit from a sign of disgust. But then this particular spit that comes from Jesus is the spit that denotes his healing. Anyway, I think about us in terms of thinking about Christ sees where we are. He sees what we're going through, and he notices us. It was in a lot of the different versions of the Bible, it literally says Jesus noticed. He was walking down the street and Jesus noticed. Sometimes we just need to know that somebody sees us, and that somebody is Jesus. And sometimes that's exactly what we need to just sit in that space right there. That little segment has just been uncovering layers and layers that I believe that just continue to reveal God's heart for us, and that he cares. So let's talk about some of the cons here. One is side effects. And there are some medications that are going to have significant or minor side effects. And it's really important for us, if you're pursuing medication, read the labels, ask your physician, do your homework to find out what are some of the side effects, because some of them, it can include dizziness or lightheadedness, hormonal issues. Some of them, quite frankly, make more hair grow, but not in the places that you want it. So just be mindful that they're going to be side effects. And so one of the things that we have to be careful about is what those side effects are and how they're going to affect us. And so as you're thinking about what medications to use, be mindful of that. Next, the second thing is dependency. And that was one of the things when I sat in that doctor's office and I'm, at the time, I'm desperate for a solution. I'm desperate for some type of help, desperate for some type of relief, and desperate for, quite frankly, I wanted some hair back on my head. One of the things that the doctors did tell me, though, was some of these medications, if you take it, you're going to have to keep taking it. I had done some of my homework before going to that visit, so I had known which one she was referring to, or actually a couple of them. And she said, if you take it, if you take this particular medication, you're going to need to continue to take it. During that session, during that visit, I decided I don't want to go this route at this time. I'm not going to sit here and say I would never use it because I don't know I don't know. But right now, for the last year and a half or 2 years, I decided that I didn't want to take it because I didn't want to necessarily be dependent on it. But that was my personal choice. Everybody, that's the beauty of this journey, is you get to make the best choice for you. So when thinking about making that choice, be mindful that there are some medications that will need to, if you start taking it, you're going to have to continue to take it in some cases. So the next con to think about is that there's what's called limited efficacy. And what this means is that not all individuals will experience the same amount of regrowth or recovery with the medication, and the results, they're going to vary. There's not much we can do about that, right? It just depends on your body chemistry and the response. But just being aware that especially when we start looking at other people for advice, whether it's me or anybody else, like it's going to be really individual in terms of what the results might be. So be mindful that individual results may vary. The next con is actually cost. Depending on the medication, the frequency of the medication, your insurance coverage, it could vary. And so sometimes costs might be prohibitive depending upon the type of medication and the duration that you need to take it. And so be mindful of what you're going to be mindful of what your expenses are, and so keeping in mind that there are going to be costs associated with taking prescribed medication, at least in the US, where our insurance may or may not cover certain types of treatment. Number 5 is that medication might not be suitable for all types of hair loss. This is one specifically you want to talk to your physician about. I've seen varying sort of approaches. Some people I've heard say if it's scarring alopecia, that it doesn't matter what the medication is. Once the scarring has taken place, what I've read is there's no medications that can bring it back, but I'm also reading something's different. The sixth con, and this is a big one, is slow results. Hair regrowth takes time. It doesn't matter. Even if you have the perfect head of hair, it takes time. So let alone if you're dealing with regrowth with alopecia. So for example, like this part of my hair, it grows fine. The middle part where the scarring, early scarring alopecia, it just grows super, super slow. It's a different texture. Now it's filled in, so I'm not at all complaining, but I'm also realistic, right? It just takes time. And so sometimes even with these medications, sometimes the results are really, really slow. And so it's really important to be aware of that. And as much as there are videos upon videos selling things that promise overnight success and growth with hair growth, it still takes time. And so being mindful of that will, in some cases, hopefully alleviate some of the stress that comes from is it happening or what's taking so long. Number 7 is actually pretty similar to number 3. So number 7 is individual response. The effectiveness of medication can vary from person to person. And some individuals might respond really positively, and some individuals might respond negatively or might not have a response. And so that's something to really be mindful of, especially if you have to try a couple of different medications. And so it's also important to think about Just because this person tried it doesn't mean that it's going to work for me. That's what I realized too when I went through it. Like I saw people who were having success with certain medications, and I was aware like it may not work for me. So I think those are some things that'll be important. So as you think about um, the pros and cons of medications, just think about these things. Um, and also, you can take this and screenshot it and share it with people, especially if you have been recently diagnosed, or if you're trying to think about, should I take this type of medication versus this type of medication? I really hope this information will help you when it comes to your decision-making process. And one thing that I wanted to share, this quote that I love that I saw recently from Dr. Anita Phillips, and she says, never choose an answer that limits God. And so as you think about what the next step is for you, let's remember to never choose an answer that limits God. As always, live well, live blessed, nourish your crown, and I'll see you in the next video.